We live in a world filled with medications. They can help, but they can also silently harm us. As we age, our kidneys naturally lose efficiency, making it crucial to limit exposure to unnecessary chemicals and medications. However, aging often brings more health problems and with them, more pills. Some medications are nephrotoxic, meaning they can directly or indirectly damage your kidneys, leading to waste buildup and serious health risks. Kidney damage varies in severity, from mild dysfunction to complete failure. The risk of drug-induced nephrotoxicity rises with age and kidney conditions, occurring in two ways: dose-dependent toxicity, where damage increases with higher doses, and idiosyncratic toxicity, which is unpredictable and varies from person to person. In some cases, avoiding these harmful medications is the best option, as they can lead to muscle breakdown, rhabdomyolysis, kidney tissue death, renal infarction, and acid buildup. Renal tubular acidosis, reduced kidney function, can lead to serious conditions like nephrotic syndrome and electrolyte imbalances. In this video, we'll uncover how common medications impact kidney health and share practical tips to manage them safely. Knowing the risks of these drugs helps you make informed healthcare decisions. Stay tuned to learn how to protect kidneys while managing other health conditions. Now, let's dive into the medications that can harm your kidneys. Number 7, antibiotics. Antibiotics are widely used to treat bacterial infections such as strep throat, pneumonia, urinary tract infections, UTI, and skin infections, but they can also pose serious risks to your kidneys if not used properly. These medications, including Cipro, Augmentin, Flagyl, Bactrim, and amoxicillin, work by either killing bacteria or preventing them from multiplying. However, they are ineffective against viral infections like the common cold, flu, bronchitis, and most sore throats. Overuse or imprescribing of antibiotics can lead to unwanted side effects, including diarrhea, liver issues, and kidney problems, even when taken correctly. Certain antibiotics like ponzviligmicicides and vancomycin can cause kidney damage by accumulating in kidney cells and harming kidney tubules. In particular, polymyxins may damage kidney cell membranes, increasing the risk of kidney injury, while aminoglycosides can build up in kidney cells and lead to cell death. Since the kidneys are responsible for filtering antibiotics out of the body, excessive or prolonged use puts them under strain, potentially leading to nephrotoxicity. If your doctor prescribes antibiotics, it's essential to use them responsibly and ensure they are truly needed to avoid unnecessary harm to your kidney health. The exact way antibiotics cause kidney damage is still not fully understood, but researchers believe it may involve inflammation and direct harm to kidney cells. To ensure antibiotics are both effective and safe for kidney health, they must be used correctly. Shockingly, nearly 1/3 of all antibiotic prescriptions in the United States are unnecessary, according to the Centers for Disease Control and Prevention (CDC), and a study published in the Journal of the American Medical Association. Many people take antibiotics for conditions they cannot treat, increasing the risk of side effects and kidney damage. Before taking an antibiotic, always ask your doctor, is this necessary? Most doctors will explain if and why it's needed. If prescribed, follow the exact dosage instructions and any food-related guidelines. Even if you feel better, never save leftover antibiotics for later or share them with others, as they are prescribed based on specific health conditions and needs. Proper antibiotic use is key to avoiding unnecessary strain on your kidneys while effectively treating infections. Number 6, non-steroidal anti-inflammatory drugs and AIDs. Non-steroidal anti-inflammatory drugs (AIDs) are widely used, but many may not recognize the term. However, you've likely heard of ibuprofen, aspirin, Motrin, Toralax, celecoxib, or naproxen, all of which fall under this category. Some NSAIDs are available without a prescription, and they are so common that over 30 million people take them daily. These drugs are frequently used to relieve headache, muscle strains, cold and flu symptoms, and arthritis pain. Their main function is to block an enzyme called cyclooxygenase COX, which helps produce pain-causing substances. However, it plays also a crucial role in protecting the kidneys under stress and regulating sodium and water balance. By blocking SOX, AIDs can potentially damage the kidneys. All NSAIDs have the potential to cause acute kidney injury, especially in older individuals or when taken in high doses or for long periods. The damage occurs mainly in two ways: by altering blood flow to the kidneys and by causing inflammation. When COX is blocked, kidney blood vessels can narrow, leading to reduced blood flow, fluid retention, high blood pressure, and mild kidney impairment. If left unaddressed, this may escalate to acute tubular necrosis, a condition where kidney tubules die due to oxygen deprivation. In severe cases, what initially appears as acute kidney injury could gradually progress into chronic kidney disease, leading to long-term health complications. Although NSAIDs are known for their anti-inflammatory properties, prolonged use can ironically lead to inflammation in the kidney tubules. the microscopic structures responsible for filtering waste. While this type of inflammation is uncommon, kidney-related complications remain a major concern, impacting 1% to 5% of daily users worldwide. That equates to an estimated 502.5 million people experiencing kidney injury from NSAID use each year. Even more alarming, these medications are frequently linked to hospital admissions due to adverse drug reactions, some of which can be fatal. A 2006 study published in the Journal of the American Society of Nephrology examined 1,084 patients prescribed NSAIDs for various conditions. The findings revealed that NSAID use increased the risk of acute kidney injury by 26%, particularly within the first 30 days of use. This highlights the importance of cautious prescribing and responsible consumption of these drugs. In another study, researchers analyzed 99 patients with chronic musculoskeletal pain who had been taking NSAIDs for 12 months. The results showed that most patients experienced kidney function decline but saw improvement after switching to a different pain relief medication. For those interested in the scientific evidence, the studies supporting these claims can be found in the description box. Now, the next set of drugs on our list may surprise you. They're often believed to be beneficial for kidney health. Number 5, diuretics. Diuretics are often used to treat fluid retention or swelling, commonly associated with heart failure, kidney failure, and liver cirrhosis. While some diuretics can be purchased over-the-counter, prescription versions tend to be more potent. Some widely used diuretics include hydrochloroside, HCTZ, bumetanide, Bumax, furosemide, Lasix, spironolactone, aldactone, and acetazolamide Dimox. These medications work by increasing urine production, effectively helping the body eliminate excess salt and water. Because of this, diuretics are often prescribed for hypertension, high blood pressure, one of the leading risk factors for kidney disease. This makes them generally beneficial for kidney health. However, despite their advantages, diuretics can pose certain risks related to kidney function. Unlike NSAIDs, they do not directly harm kidney tissue or impair filtration ability. Instead, they act further along the kidney's processing system, modifying urine concentration and electrolyte balance. These changes can lead to an increase in urine output or an imbalance in essential electrolytes, which may affect overall kidney function if not properly managed. Overusing diuretics or taking high doses can cause dehydration, which is a major risk factor for kidney damage. A study examining 131 patients who experienced acute kidney injury while using diuretics between 1999 and 2010 revealed that 90.2% of them are released one underlying health condition before starting diuretics. Among these, chronic kidney disease CKD was the most common, affecting 5% of patients. The study also found that diuretic users had a higher likelihood of developing kidney disease, especially when risk factors like hypertension and diabetes were present. The higher the dosage, the greater the risk. Notably, 27.5% of acute kidney injury cases were attributed solely to diuretics, while others resulted from a combination of diuretics and other medications. This highlights the importance of consulting a doctor before starting or adjusting diuretics for individuals with CKD. Proper hydration and regular monitoring of electrolytes and kidney function are essential. Fortunately, advancements in home testing kits now allow people to track their kidney health from the comfort of their homes, making early detection and prevention more accessible than ever. Number 4. Proton pump inhibitors PPIs. Proton pump inhibitors PPIs are widely available over-the-counter medications that effectively treat conditions like gastric disease, reflux disease GRD, and acid reflux by reducing stomach acid production. These drugs work by targeting an enzyme called H-lipoprotease, also known as the proton pump, which is essential for acid secretion. While PPIs are generally considered safe and highly effective in relieving acid-related discomfort like heartburn, they are not without risks, particularly when it comes to kidney health. Studies have linked PPIs to acute interstitial nephritis AIN, a condition that causes inflammation between the kidney tubules, although only a small percentage of PP users develop AIN. This medication has become a leading cause of drug-induced AIN in many developed countries. What makes this concerning is that AIN due to PPAs often presents no noticeable symptoms, allowing to go undetected until it impairs kidney function. Long-term PPI use has also been associated with acute kidney injury and chronic kidney disease, CKD. Additionally, these can lead to low magnesium levels in the blood, a condition known as hypomagnesemia, which has been linked to CKD progression. In simple terms, hypomagnesemia can upset your electrolyte balance, contribute to inflammation, and increase the risk of kidney disease over time. Low magnesium levels can lead to serious health issues, including muscle spasms, seizures, and irregular heartbeats. A 2009 study published in the journal Pharmacotherapy examined the effects of PPIs on kidney function by analyzing how their use correlates with new cases of kidney injury, AKI, and chronic disease, CKD. In a large study involving 93, 3D researchers found that research individuals using PPIs had a 4.35 times higher risk of developing AKI compared to those who did not take these medications. PPI use was associated with an increased risk of CKD when they studied 84,600 participants. The data revealed that PPI users faced a 1.2 greater risk of developing CKD than non-users. Because of these risks, regular checkups are essential for monitoring kidney function and magnesium levels in people taking PPIs. Remember, the solution to one problem shouldn't become the cause of another. While PPIs offer effective relief for acid-related conditions, prolonged use can negatively impact kidney health and lead to other complications including infections, fractures, and nutritional deficiencies. To minimize risks, it's best to use PPIs for the shortest duration necessary to manage acid-related issues while avoiding long-term side effects. Number 3. ACE inhibitors, angiotensin-converting enzyme. ACE inhibitors are prescription medications commonly used to lower blood pressure and manage heart, blood vessel, and kidney conditions. Well-known ACE inhibitors include lisinopril, zistroprinivol, ramipril altase, enalapril, and benazepril. These drugs function by blocking an enzyme responsible for producing angiotensin, a substance that causes blood vessels to constrict and blood pressure to rise. By preventing its formation, ACE inhibitors help relax blood vessels, leading to lower blood pressure and reduced strain on the heart. These medications also increase blood flow to the kidneys, which helps lessen the workload on these vital organs. Because of this, ACE inhibitors can provide kidney protection, especially in the long term. Additionally, they may reduce protein levels in urine, a common issue in chronic kidney disease CKD, making them a frequent treatment choice for kidney patients. However, despite their benefits, ACE inhibitors come with risks. When combined with NSAIDs or diuretics, the likelihood of developing acute kidney injury AKI increases additionally. Dehydration while taking these medications can further raise AKI risk. If you're concerned about how ACE inhibitors might affect your kidneys, consulting a doctor is the best way to explore ways to reduce potential risks while maximizing their protective benefits. Some people worry that ACE inhibitors might lower their estimated glomerular filtration rate (eGFR), a key measure of kidney function, where higher values generally indicate better filtration. However, ACE inhibitors reduce eGFR by easing pressure on the kidneys, allowing the glomeruli, tiny filtering structures, to relax. While this may lead to a slight drop in eGFR, it's not necessarily a sign of kidney damage. Rather, it reflects reduced strain on the kidneys. That said, in some cases, eGFR can drop too much, posing risks for people with heart failure, chronic kidney disease CKD, or blockages in both renal arteries, bilateral renal artery stenosis. If this happens, a doctor may adjust the dosage or pause the medication temporarily to identify the cause. In rare instances, particularly in patients with heart failure or severe dehydration, ACE inhibitors can lead to acute kidney failure. However, in most cases, kidney function recovers after stopping the medication, even in patients who may temporarily require dialysis. Despite these concerns, ACE provides significant long-term kidney protection for people with heart failure, diabetes, or CKD. However, it's essential to carefully adjust dosages and monitor kidney function regularly to ensure safe and effective use. Number 2, antiviral drugs. Most viral infections clear up on their own, but antiviral drugs are prescribed for severe or persistent infections like COVID-19, Ebola, flu, genital herpes, hepatitis B and C, and HIV. These medications help reduce symptoms and control the virus, but their effects vary. For flu treatment, common antivirals include oseltamivir, Tamiflu, and zanamivir, Relenza, which help the body fight off the virus faster. However, for chronic infections like HIV, hepatitis, and herpes, antivirals cannot fully cure the disease but help ease symptoms and manage progression. While antiviral drugs offer significant benefits, they can also pose risks to kidney health. Kidney damage from these drugs can result from direct toxicity or the formation of crystals, which may lead to kidney stones. This makes careful monitoring and tailored treatments essential, especially for people with pre-existing kidney disease. Take, for example, remdesivir, an emergency use drug for COVID-19. This medication contains SBFD, a compound that is primarily filtered by the kidneys in patients with kidney disease. SBFD can accumulate, potentially leading to kidney toxicity. Some clinical trials have shown inconsistent reports of declining kidney function with remdesivir use. Additionally, global health data has revealed a notable increase in kidney failure cases linked to remdesivir compared to other COVID-19 treatments. Currently, there isn't enough large-scale clinical data to determine whether remdesivir is safe or harmful for people with kidney disease, making further studies necessary. However, beyond remdesivir, many potent antiviral drugs have been linked to a drug-induced acute kidney injury. Some antivirals, such as citalopram, foscarnet, aciclovir, interferon, And tenofovir can cause acute tubular necrosis by reducing blood flow to the kidneys or increasing toxin levels, leading to cell damage in kidney tubules. Additionally, atazanavir has been associated with kidney inflammation, interstitial nephritis, impairing kidney function. Other antiviral drugs like acyclovir, indinavir, and foscarnet may lead to crystal buildup in the kidneys, potentially blocking kidney tubules and causing complications. On the other hand, cidofovir and foscarnet are sometimes used to manage kidney-related conditions, but they also increase the risk of kidney failure. To protect kidney health, it's essential to take antiviral medications under strict medical supervision. Skipping doses or taking them inconsistently can cause viral adaptation, making the drugs less effective, a phenomenon known as antiviral resistance. Also, since antiviral drugs require a prescription, it's crucial to avoid purchasing them online or from unofficial sources to ensure safety and effectiveness. Number 1. Lithium. Lithium is a prescription medication commonly used to stabilize mood and manage certain mental health disorders, such as mania, a condition where a person feels overly excited, hyperactive, or easily distracted, in bipolar disorder, which involves extreme mood swings between mania and depression. Some well-known brand names of lithium include Priadol, Camcolit, Liscanum, and Liquid Carb. For more than 60 years, lithium has improved the lives of many people dealing with bipolar disorder. While lithium is essential for balancing mood, its effects on the kidneys cannot be overlooked. Long-term use has been linked to serious kidney issues, including acute and chronic kidney disease, and even the formation of kidney cysts. In the early stages, lithium-related kidney damage may be reversible, but over time it could become permanent. One major concern with lithium use is a kidney-related condition called nephrogenic diabetes insipidus and DI. Unlike diabetes caused by high blood sugar, this disorder happens when the kidneys stop responding properly to the antidiuretic hormone ADH, which regulates fluid balance. As a result, people with NDI experience excessive thirst and frequent urination, often leading to dehydration and kidney strain. Long-term lithium use can in rare cases lead to end-stage renal disease ESRD, causing permanent kidney failure. Early warning signs include excessive thirst, frequent nighttime urination, dehydration symptoms like low blood pressure and rapid heartbeat, and in severe cases, mental confusion or altered consciousness. Lithium can also trigger hyponatremia, where the kidneys lose too much sodium, which, if it happens suddenly, can result in rhabdomyolysis, severe muscle breakdown, seizures, coma, or even death. To minimize risks, patients should maintain a proper salt and fluid intake, take lithium only as prescribed, and undergo annual kidney function tests. Medical attention is essential if unusual symptoms arise. Since lithium affects more than just the kidneys, it's crucial to inform your doctor if you have kidney disease, heart conditions, thyroid problems, breathing disorders, Addison's disease, or Brugada syndrome before starting treatment. Extra tips for safe medication use. Are you concerned that your medication might be affecting your kidney health? Seeking medical advice as soon as possible is crucial. In the early stages, kidney failure may not show obvious symptoms, but as it progresses, signs like reduced urine output, leg swelling, shortness of breath, and extreme fatigue become more noticeable. If left untreated, this condition could be life-threatening. Stay informed about these warning signs to take action when needed. If you are taking any of the medications discussed in this video, make sure to monitor your kidney function regularly through tests such as blood creatinine levels, glomerular filtration rate (GFR), and urine protein analysis. Maintaining proper hydration is essential, as it helps your kidneys eliminate sodium, urea, and toxins, reducing the impact of drugs that may harm kidney function. Additionally, be mindful of drug interactions that could further stress your kidneys. Always inform your healthcare provider about all the medications you are taking before starting a new prescription. While medications are necessary for managing various health conditions, some can significantly increase the risk of kidney damage, especially in individuals with pre-existing kidney disease or those prone to kidney issues. Use them cautiously and under proper medical supervision. Certain medications, including antibiotics, NSAIDs, diuretics, proton pump inhibitors, PPIs, ACE inhibitors, antiviral drugs, and lithium, can negatively impact kidney function. These effects may result from direct toxicity, altered renal blood flow, or electrolyte imbalances. For individuals with kidney disease, it's especially important to avoid or carefully manage these medications under medical supervision. Working closely with a healthcare provider is essential to selecting treatments that reduce kidney risks, adjusting dosages when needed, and monitoring kidney function regularly. Leading a healthy lifestyle can also reduce reliance on medications. Focus on a balanced diet that includes lean proteins, fruits, and vegetables, and incorporate regular exercise to support kidney health. If you're committed to taking charge of your kidney health and learning how the body works, be sure to like, share, and subscribe. And turn notifications so you never miss a life-saving video. Also, check out our next video. Stay informed, stay healthy. See you in next.